everyone, Dr. Charlie Johnson, a physical therapist. Short video to kind of help you understand what could be going on if you have buttock pain. All right, so there's 4 major causes or players that come into the picture if you have buttock pain. And probably the best way to understand what's causing it is to understand where these specific joints or areas actually send signals to. And buttock pain can be difficult because a lot of it overlaps, all right? Specifically, though, I want to focus on one that's often overlooked, and it's the hip, so the hip joint, okay? So just this morning I had a woman come in. She's had treatment to her back. She's had injections to her back. They even considered surgery to her back. And she's had physical therapy, chiropractic care, all focusing kind of at the back or the one of the joints within the pelvis, the sacroiliac or the SI joint. And what we found today is that I could consistently bring on her buttock pain by testing or moving around specific things within her hip, okay? So it was actually a hip problem causing her buttock pain. So I just want you to take home really quickly that if you've had buttock pain, you've been treated for piriformis syndrome, other issues, back pain, and everyone keeps telling you it's from your back, and they're not listening to you. It actually is true, and it could be that your hip pain or a problem within your hip joint is actually causing you to feel some buttock pain, okay? So with that being said, you're looking from the side, looking in. You can see the foot there. This is the front. This is the back. This would be like the buttocks. This would be like the groin. Here's the lower back, the 5 bones in the back. And real quick, because I'm going to zoom in on the hip joint, this right here is the hip joint, all right? So there's kind of your ball and socket. And what we see is that there's a problem within the joint. There's going to be a couple different places where people could feel pain, all right? One of the most common areas is going to be within the groin. So if you're younger, maybe it's a pinching pain. If you're a little bit older or wiser, maybe older than 50 years old, greater than 50, you might feel like a deep kind of ache within the groin. And or in some cases what we see is that you may feel a little knee pain. We know that the hip joint can refer to the knee. But the other place that we see it, that the hip sends signals to, is to the buttock. So you often feel like a deep kind of pain that's kind of radiating from the front to the back. So people with hip pain often will have what we call a C sign, which literally C is in the letter C, okay, as in my name. So you're going to take like your hand, and if you're kind of doing one of these where your index finger is like on the front of the hip, kind of towards the groin, and then you're kind of like wrapping it around your thumbs like towards your buttock, then that's a sign that that would be called a C sign, and that's a sign that the hip might be a problem. So this kind of front pain in the groin, this back like deep buttock pain is what we see. And then we also see it when the hip's not functioning well, some of the muscles get overworked. So there is a buttock muscle on the side, actually, one of the buttock muscles, that goes from the top of the hip up kind of to the side of the pelvis. And when it gets overworked or irritated, it can actually send signals that go down the outside of the leg all the way to the outer shin and or the top outside of the foot, okay? So it's almost like a feeling of sciatica or a nerve problem, but when in fact it's actually just from some of the muscles being irritated in or around the hip, okay? So it doesn't cause numbness or tingling. It just feels like kind of like a dull, achy pain that goes down the leg, okay? And that can all be from the hip. So again, the take home from this is that if you've been treated for your back, if you've been treated for problems within your pelvis, if you've been treated for other things, so other things could be pelvic floor problems, there's different arteries and vessels and things like that. There's also nerves. If you've been treated for piriformis syndrome. If you've been treated for all these things and you're still having buttock pain and or some groin pain, and maybe even have a little knee pain or pain going down the leg, there is a possibility that the hip joint could be the culprit. So if you got something out of this, subscribe to my channel, like below, comment below with your hip or buttock pain story. I'd be happy to hear it. And then, yeah, so email me directly at charliejohnsondpt@gmail.com if you need help. Thanks.